Or Mike is. Call this Washington County Board of Education meeting to order. After a moment of silence, I'll ask Mr. Fleener to lead us in the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Technically, first thing is the consideration of attendance supervisor job description. Mr. Boyd, you got that?
Yes, sir. It's on the screen. Essentially, the intent of this is we certainly have had an attendance supervisor, but it's been included and folded in to the job responsibilities of one person for quite a while. And revisiting the job description based on requirements at the state level for this particular role in a school system, and then also just fitting the needs of Washington County. This person will be, it's a certified position, supervisory leadership position for the district that will be responsible for all aspects of compulsory attendance compliance. Also just involved in interventions with whether it involves court as a truancy officer, so relationships with our court system, our juvenile court system, working with schools, staff, principals, and others to do preventative measures that prevents truancy, and then so everything, all aspects of attendance. One of the metrics as a state, and that's kind of a measurement for districts is, of course, chronic absenteeism, in addition to overall absenteeism. So this person would be the lead person in monitoring those levels at each school and across the district, and providing supports and guidance and resources. You can read each of the items. Dropout prevention is certainly a big responsibility in identifying early warning signs of students, working with schools, counselors, principals, and others to identify students that are at risk of dropout and implement strategies that could include alternative placement if necessary. Put them in a different, more smaller learning environment, supportive environment, like our alternative programs have provided, whether that is disciplinary reasons or just a best placement for students to prevent dropout and to encourage and support them to be successful and graduate high school. So their work stream will basically be focused on attendance and placement of students, whereas previously it was, the individual was responsible for a lot of other areas, including school safety. We're going to assign those to other teams, and this person will focus directly on attendance measures and truancy prevention and mitigation.
Mr. Meredith has a question.
Yes.
Does the revised position, other employees that directly report to the attendance supervisor, how many and what are they?
Well, this individual, looking at the resources that were previously allocated, I do believe it's important to maintain one administrative secretary support for this person. But this individual will report directly to the Chief Student Services or Supports Officer, Dr. Myers. And then that individual, that administrative secretary assistant would report directly to the attendance supervisor or director of attendance. I mean, we said attendance supervisor based on our pay scale. It would be on the director pay scale, program director pay scale. At least the intent is. Being certified, we would basically take what we have in other pay scales, make it a 12 months. So we would take, if somebody was currently an educator in our school system, we would look at where they fall in their years of experience and their education level and the lane that they're in, and then make sure that's a 12-month salary based on that 200, that per month amount, and then plus an additional month as a somewhat of a supplement for the responsibility as a overall director of that attendance program. So it would be a 13-month, so to speak. Even though 13 months doesn't exist, we use that 13th month to identify a fair way to have a stipend, additional supplement. Yes, ma'am.
So the job opening is on our website now?
Yeah, we went ahead and put it out there. Yes, ma'am.
What is the deadline?
Until filled.
Oh.
Yeah,
okay.
yeah, yes, ma'am. We want to leave it up a minimum of 10 days in that neighborhood, but until filled.
Anybody else?
Do you need a motion to approve this new position, or?
Even though it's not technically a new position, it is with the job. It has a unique job description now. So I asked the board to consider approval.
Make a motion for,
Well, I was gonna ask roughly what do you feel like the salary will be?
We were having a really good discussion earlier. Looking at the current program director salary scale that's been approved by the board, that range is from, and Mr. Hale, correct me if I'm wrong, without looking at it, up from an entry level of 66 and a ceiling of around 88 for a 25-year, if you look at it at 25 years. Yes, step level.
Compared to the previous one.
A little lower because there was
Less.
Yes. So the responsibilities are more narrow, so that's why it's in a different category of pay.
Where will they work out of?
The attendance supervisor,
Where will they be
right
next
now,
year, or up there, or where?
I would defer to Dr. Myers, but we're looking at space at Midway as an office, basically an annex to all of the office needs that we have.
Anybody?
Just, and another thing that's been discussed, and I think Mr. Gray is certainly open to it, is if we put that individual at Asbury where the students would be, because typically students that are placed in an alternative program, the truancy officer is very familiar with. So there's a possibility we may be able to identify a space for that person to be there and their support staff.
make a motion we approve the new title attendance supervisor position. Is that right?
Yes, sir.
All right, we had discussion anymore? Mr. Master. All right, let's vote, please.
Mr. Masters?
Yes.
Mr. Ritter?
Yes.
Mr. Irvin? Ms. Dellinger?
Yes.
Mr. Flainer?
Yes, ma'am.
Mr. Hammond?
Yes.
Mr. Meredith?
Yes.
Mr. Day?
Yes,
All approved.
thank you. Next on the list is COVID protocol for school year 2021. Mr. Boyd.
Sir. As she pulls this up, as I believe everyone's aware, we have shared this with everyone to ensure full awareness. And as of this morning, just to call out, there have been some additional updates in the CDC guidelines that recommend mask wearing for everybody. But even in this version, prior to the update this morning, we have chosen to look at regional and community practices that we currently have. And so that's why we're trying to align ourselves with what the reality is in our region. And that's why, number one, mask will be optional. Even though the CDC has recommended, or prior to this morning, they recommended masks for everyone that's not vaccinated. And then this morning, they've updated it to regardless of vaccination status, mask wearing. So, that's what we're facing as a school system, is making decisions that are local, certainly paying attention to the recommendations of the CDC, but looking at our information here in this region and in Washington County, and making decisions that we see that best fits Washington County. And so these are the guidelines. If you read through there, most of these, some are directly aligned to CDC guidelines and state level recommendations. Some are not. Some are looking at practices and not just in our schools, but what it looks like outside of our schools and in our shopping, our shopping centers and so on and so forth right now. And so we would just try to align. But some specifics for our school personnel, we definitely will continue preventative measures as much as possible. I mean, the sanitation, the cleaning, and monitoring anybody that has any kind of symptoms. And so we will continue all of those monitoring practices and preventative measures. When possible, the social distancing as much as as much as reasonable and feasible, and when possible, cohorting in grade levels that's feasible as well. Our staff, instead of self-serve, if there are any self-serve items in our school nutrition, our cafeterias, kitchens, we will continue to make sure we have single serve and it's basically provided by the kitchen staff instead of students reaching and grabbing their own choices. Water fountains, that's just another measure. We closed down, and as was everyone, has closed down the typical water fountains. We have put in some water bottle stations, which are appropriate for individual water bottles of students and employees. So we'll use those, but not the typical water fountain.
That's what I was gonna ask. So they are available in all schools? Everybody has access to that?
It's my understanding we've installed at least one in every school.
At least one is in every school.
Yes. Yeah, over in the long term, it definitely, whether we're replacing old water fountains or we're trying to update them, it makes sense to put more of these in schools, have them accessible, regardless of COVID. It just makes sense. The symptoms going to number 6, as I would just read down the list. We'll continue to monitor and rely on our health professionals in our schools to use their professional judgment, look at the information in front of them, the symptoms and the situation, and make an informed decision at that point about the symptoms and follow those protocols. As you can see, any person with a positive test, we will follow those exclusion protocols. If they have been vaccinated, there's some differences there. If they have symptoms, though, we still have to send them home, because even though the percentage is very low of vaccinated individuals that contract COVID, if they present symptoms, we have to act just like we would with anyone else. If they are excluded, and Ms. Wagner can jump in here and help me, and they've been vaccinated, whether, I think a negative test can.
If someone is excluded due to symptoms, it doesn't matter if they're vaccinated or unvaccinated, their way to come back would be, one, they could stay out the 10 days and return if they don't have a fever for more than 24 hours and they have symptom improvement. Or they can go get a medical evaluation and the doctor can give an alternative diagnosis explaining the symptoms that they have. And the third option would be get a PCR COVID test and it be negative and they can return back. That is just for someone that is symptomatic.
So the 10 days is just if they choose, they're fine staying out for 10 days?
Yes.
But there's several different ways to prevent that.
Yes.
Well, no.
Because if they are positive, they're automatically out 10 days.
Ah.
And if we don't know, then that's
Yeah.
what we would have to do.
prior practice has been, everyone's
Yeah.
subject to that, but now there are options, avenues that if they can prove that, they're not positive
Right.
through those channels, then they can return.
Well, they was talking about on the news last night that school systems are giving COVID tests. Are there anything to do that?
Some have chosen to do that. There are requirements for that, for systems that have gone that route. We have made the decision to defer that to, the centers that do testing.
We will through telehealth. So how we swab right now for flu, and we swab for strep. The flu swab, we're changing it to a fourplex, so it will test for flu A, flu B, COVID, and also RSV. And that's through Ballot Health. We chose not to test through an outside lab to where we're doing screenings, but we will be testing through our telehealth program.
So when you swab one, there's a chance it's got one report.
Yes, or it's negative. Could be a PCR test. It would take 2 to 3 hours to get the results, but obviously if someone's symptomatic enough for us to do the test, they would be going home anyway.
Ms. Dellinger.
Everybody's wanting things to be normal, and I get that. Should our cases go up in our county, and are we going to listen to the health department recommendations? I want to know if there's a level, at what point, and does the board have to approve different things?
I think we need to monitor the tiers as far as the percentages, listen to our local and regional and state health department guidance, and we want to include and inform the board and include the board, and if we step it up, because we also need to be prepared if that becomes necessary, communicate it so everyone's clear, but our communication needs to ensure that people understand we're starting this way, but if the data shows signs that we need to have more strict and stringent protocols, then we'll have to elevate. Yes, ma'am. But that will be because of every week and the information we receive in the weekly calls with our local regional health department and medical professionals that includes everyone in the region. We certainly will adjust.
You will go ahead and act and not have to get a board approval. You'll go ahead and make that.
But I can, and I'd be happy to do that, but I would want to make sure I inform the board. But with the new law, if there are closures due to COVID, the board has to act.
All right. Thank you.
Mr. Riddle.
I'd like to make a motion, we approve the COVID-19 guidelines for Washington County schools for the school year 21-22.
Second, Mr. Fleener. Any more discussion?
Two questions. We don't have a virtual option this year, do we? Or do we? I mean, do we, where parents can opt?
We currently have a virtual option in grades 6 through 12.
Okay.
Not below 6th grade.
Okay.
We have an approved virtual school for those grade levels, but not below that.
Okay. And then the second question really has to do with those lower grades. Mask wearing is optional.
Yes, sir.
Is it optional at the student's choice or optional at the parent's choice? How do we?
Well, I think I don't know if many parents, if their child wants to wear a mask and they don't believe they need to, but if they want them, if the child wants to, I would imagine they would want their child to
Kind of
have that
thinking the
option.
other way around.
No, I
The parent
understand.
wants them to wear it.
Well,
the kid
if the
doesn't
parent
want
wants them to wear it, then I think that's that individual family's choice, and that's what that child needs to do.
Well, do we have a way of enforcing that?
I don't think it's, I don't know that our staff is able to police that,
Okay.
because of the choice option. But, I'm sure just in good faith, wanting to work with parents, an awareness and do our best effort, but we can't guarantee that we can police that 100% of the time.
I really want to go, but Miss Dillinger wants to
I
go.
just had a
That's
follow-up
enough.
question that Mr. Meredith had. If a parent wants to put their seventh grader on virtual after like 3, is there a time they have to go per grading period? Can they wait 3 weeks and then,
I believe it's important to work with families on an individual
So,
basis. I mean,
it
we
would
would
be-
want, we want to follow board policy. I mean, when we start school, they need to be enrolled in their school
Right.
that they're eligible to be enrolled in. If there are changes because of situations, we'll have, we'll take those requests directly from parents. We may have to tell them no, but we certainly want to give them that opportunity to request and fully consider their circumstances.
that's good, thank you.
I got a question. I don't really have a stance on it, I don't believe, but why is it 6 through 12 only?
We previously had an approved school number of virtual school for many years, and by state, just a requirement that we applied to extend it down. We could extend it down 3 grade levels this year. My hope is that we continue over the next few years with board support, extending it down at least to 3rd grade.
So let me ask you this, is this was, and I'm asking this because I had a lot of parents complain to me that their children, which I don't know why they allowed it, but I had parents actually complain to me about their kids, the coaches asking them to stay out virtual so they wouldn't get sick and wouldn't miss sports. Of course, the parent was allowing that, but I guess my question is, are we gonna do virtual this year to where if you're virtual all year, or you can't just be virtual at football season or basketball season or whatever? Cause
Yeah, I mean, if
I
they,
don't think it works.
we need to treat our virtual school just like all of our other schools and the transfers within, in and out.
Yeah.
So the answer to that is, the intent is no. I mean, if they enroll in our virtual school with the intent, they need to plan to be there all year. There are circumstances that we will need to consider on an individual basis. But in that specific, I think if we're able to continue with these flexible options about the exclusion, if they can prove, that they have another diagnosis or negative for COVID, then they would not be subject to that long-term quarantine that I would imagine is why those coaches encourage their players and families to consider the virtual option. But right now, we're treating our virtual school just like we would any of our other.
You're either in or you're out.
Yes.
Okay, good. Mr. Real?
Just one quick question. As far as their assignments and things, if someone were to be out for the 10-day period, how would they receive or do their assignments?
We would have to, again, it'd be individual basis right now. For example, if they were on homebound or and previously if some child received, they had the flu or some other illness, I mean, it would just be directly working through the school with their teacher.
Thank you.
All right, no one else? Let's vote.
Mr. Masters?
Yes.
Mr. Riddle?
Yes.
Mr. Irvin?
Yes.
Ms. Dillinger?
Yes.
Mr. Fleener?
Yes, ma'am.
Mr. Hammond?
Yes.
Mr. Meredith?
Yes.
Mr. Day?
Yes.
All agreed.
Okay,
Make a motion with your.
we need a second on that. Meeting adjourned.
You have the gavel.
All right, that one's over. Was we 1 minute off from the next one? Make it quick, Mary Beth.
Thought Mary Beth was gonna take a whole 15-minute break.